So if you ask somebody with epilepsy, what sort of difficulties do you experience in relation to your memory? They'll say, on average, they can't remember, for example, the contents of a conversation they had maybe in the last 24 hours. They sometimes have the tip of the tongue experience where they know they want to use a word, they know that word, but they can't access it. They sometimes forget people's names. They will often complain about forgetting appointments. And these are the same sort of memory problems that we all experience. But if you have epilepsy, you experience them to a greater degree and in a greater frequency. So if we look at memory, for example, we know that people have difficulty sometimes encoding information, storing information, or retrieval. And they can have a deficit in any of those areas. In any individual, you would look for a number of factors that would cause them to have memory problems. The first factor is the effects of the underlying brain injury that cause them to have seizures in the first place. And we know, for example, that damage in the amygdala and hippocampal structures of the brain, that area is very, very sensitive to memory functioning. So most of our memory functioning goes on in that area. Unfortunately, that's an area that's commonly associated with the site of the injury to the brain that causes the epilepsy. There are other reasons why people have memory problems as well. Sometimes it may be to do with their anti-epileptic drug treatment. When we've reviewed the evidence on this, there's not a great deal to suggest that there is a very clear relationship between anti-epileptic drugs and memory problems. We know that some drugs may be associated with memory impairment. So, for example, we know that drugs like zonisamide and topiramate can actually cause impaired cognitive functioning and make people's memories worse. Generally, most anti-epileptic drugs don't specifically cause memory problems, but what they might do is to actually exacerbate existing memory problems because they produce a sedative effect. But of course, every drug interacts with every individual in a different way. There's another reason why people have memory problems, and that's because they're sometimes anxious and depressed. There's a significant body of research that suggests that if you have epilepsy, you're much more at risk of anxiety and depression. And we know that these two factors cause people's perceptions of their memory to be much worse than they are. Anxiety and depression, we know, impairs your ability to think clearly, to encode information, to store it and retrieve it. So they really do cause people to have difficulties with their memory. So if you treat anxiety and depression, you actually might see a general improvement in people's overall cognitive functioning. And by that I mean their attention, concentration and their memory. However, that will not improve their memory functioning to the point where they'll no longer have a problem, because we know that the memory problems they have are also partly related to the underlying problems of their brain structure that causes them to have seizures in the first place. So every time I assess somebody for memory problems associated with their epilepsy, I try to think about the nature and type of epilepsy they have, the underlying brain structures that might be impaired, the medication they're on, and their general mood. And those factors together interact to produce a memory problem.